What is hospice care and what kind of services are provided? What can people expect?
Yeah, hospice care is actually a support to support and honor individuals of their health journey in a way that they see valuable. So hospice is if you have a chronic illness that's no longer going to get better, things like COPD, dementia, Alzheimer's, any chronic illness, you could qualify actually for the hospice benefit. And a lot of people think hospice means very end of life, but we actually have people on service for years. So that's my part. I'm a patient navigator. So my job is to educate the community of what hospice is and to be able to get them benefits sooner rather than later, because I've experienced people only using the benefit for a few short months when they could be using this benefit. So it's a benefit being able to use wherever a patient calls home.
Got it. And so what kind of services are provided within that hospice care? What can people expect to receive? What does that look like?
So with hospice care, you get a whole team of people.
Okay.
So you get a nurse, you get a nursing assistant, a social worker, a chaplain. We have volunteers. There's just a whole team of people that's individualized for that person. And it's great because you get the same nurse and the same aide coming, and you get to really it's like an extension of your family. And then you also get any medical equipment that you need covered, most medications. So it's really as a whole that we try to do spiritual, physical care for an individual.
Got it. And so I think a lot of people have a misconception of what hospice is, and they do think it's the very end of life. Maybe it's the last couple of weeks of life. But that is really far from the truth. Like you said, people can be on hospice quite a long time and receive that support. But the idea is you're probably not continuing maybe certain medications to improve your condition, right? We're kind of going off those medications. We're giving you that support that you and your family need in those last days, weeks, months. Could it even be years, Wendi, that someone's on hospice?
Yeah.
Okay.
For sure. It could definitely even be years. And yeah, the point of hospice is comfort care, to provide you to have the best quality of life is what we want. And there's actually studies out there that show that people live 30 days longer on hospice than they would without hospice because we're doing care in the home. You're not going in and out of the hospital as much. You're not prone to as many infections. You're not seeking that aggressive treatment. You're looking for the value of time, not just the length of time, but you want that value of time with your family. And that's what we're there to support with. My gramps was actually on our service, and he was on it for a year and actually got better because he quit going in and out of the hospital, quit getting infections. And he can actually even graduate from hospice. So he graduated, and then you can come back on hospice when it's needed again. So you can't only be on hospice once or twice. Like as many times as you need it, if you can graduate and get better, you can come back on it. There's no penalty for that.
That's really interesting. Yeah, I don't think most people probably know that. They probably just think, oh, it's a one-time thing, last couple of weeks of life. Not the case. You can go on and off. Yeah, that's really good to know, Wendi. Can you talk to us about the length of even during the day? Like this is not 24/7 care, right? Talk a little bit about that. What can people expect if they have a loved one that's on hospice? How much time would these professionals be helping your loved one?
Yeah, and I always try to describe hospice as when you're getting care from a family member, even in assisted living or a facility, it's like a cupcake. A cupcake is good, right? The icing on a cupcake is great. And hospice is kind of like that icing on a cupcake. It's giving you extra services. So we're not 24/7, but we do have levels of care. So we tend to look at the individual, make a customized plan. Typically in a home environment, you'll have a nurse coming out 2 to 3 times a week, usually for about an hour at a time. And then our aides come out typically 3 times a week.
Okay.
And for about an hour at a time. Now, if you're experiencing symptoms, if you're having a lot of pain, we do not leave you until that pain is managed. So there might be times where our nurse needs to be there 2 or 3 hours until that pain is managed or that symptom's being managed if you're feeling nauseous or whatever. So we kind of customize it, but typically it's about an hour at a time each time one of our disciplines come. But if it needs to be longer, we can. We do provide a service called continuous care. So if in that stage of passing away, you would like someone to be at bedside, we do provide continuous care and have a nurse 8 hours a day with you during that end of life time.
Oh, okay. Good to know. I didn't realize it could really extend that long. I'm familiar with, maybe a couple hours a day. That's what I hear most common, but it is good to know when you get to that point.
Towards the end, if the family needs support, because it's a scary situation, and if symptoms are not managed, we want to be there with the patient.